So first of all, thank you, Claire, for the opportunity, but also thank you to the International Domestic Workers Federation. It's a pleasure to be collaborating with you again. And so I understood that what I had to try to provide information on was the overall notion of care policies. And I think with COVID-19, we have we've really heard a lot about care policies, and we have seen a lot of countries actually trying to support, improve, or put in place responses that actually were based on care policies. So the idea here is really to look at the package of care policies, what they are, what they can do, and why do we need them so badly. And so care policies, we need to, when we say care policies, we need to think that they are public policies and that they allocate resources, and we will see in what type of form, to recognizing, reducing, and redistributing what we have discussed about before, the unpaid care work. So when we say resources, we mean money, we mean services, and we also mean time. So if we look at money, I'm pretty sure that you can come up with some ideas of what do we mean by resources, care policies that allocate resources in the form of money. What can this be? Any idea from all of you connected?
Some tax exemption if you are doing care work for your home.
Yeah. Or cash for care transfers, for instance. So it's really about supporting directly the person with money to care, right? It could also be in terms of social protection schemes that basically acknowledge that there are care contingencies in people's lives, such as family care or upbringing of children, etc. So it's really much about transfer of cash or in kind sometimes to persons in need of care. So this is one type of policy that allocates resources that eventually can reduce or redistribute unpaid care work. Then we have resources that are in the form of services. What could they be, for instance? Any idea?
Can you repeat the question?
Yeah, so we said that care policies allocate resources in the form of money, and we have looked at social security, social protection, for instance. We have looked at cash transfers, but care policies can also allocate resources in terms of services. What could these services be, for instance? Here we're very much talking about childcare facilities, long-term facilities, centers, daily centers for people with disabilities. We are talking of education. We are talking of also sometimes health services, but we're also talking about care-relevant infrastructures. That could be hospitals, that could be roads, streets, that could be transportation, sanitation, water, etc. All services that can reduce the time of women, in most cases, to do unpaid care work. And then we have the third side, which is care policies that allocate resources in terms of time. What could these policies be? These are all types of leave policies that that are regulated in many countries, such as maternity, paternity, parental leave, sick leave. In some countries now, also other types of leave related to violence, for instance. Or this can be family-friendly working arrangements. We have seen a lot how teleworking arrangements have been helpful in during the COVID-19 crisis. It could be part-time arrangements. It could be different types of smart working arrangements. So all of these different types of policies have the potentials, when well designed, well formulated, when well funded and well implemented, to actually reduce the time that people, women in particular, spend on unpaid care work, redistribute the unpaid care work between women and men, but also between the family and the state. And first and foremost, they do recognize the importance of unpaid care work and therefore the need to come up with very good policies. So now the fact that we need care policies has been widely recognized. And we will see later on, and as Umberto has already mentioned, the importance of care policies from a point of view of economic and social outcomes. But we do need transformative care policies. And this is an important concept because we need policies that are very much anchored in important principles, policies that have a role, play an important role in addressing unpaid care work, in equalizing unpaid care work and promoting gender equalities. So to go back to the initial point of Fish, looking at care policies, care work, domestic work, vis-a-vis gender equality, the promotion of gender equality. Care policies that can mitigate these inequalities between women and men, but also between the responsibilities of families and the state. And policies, care policies that can also mitigate inequalities that are faced by particular groups of people that have a high demand and need of care, in particular women, but also girls and people from socially disadvantaged groups. So if we look at this transformative care policies, these are anchored in 4 key principles. So the first one is gender responsive and human rights based. So care policies really need to be formulated and implemented to actively and systematically encourage the achievement of non-discrimination and gender equality. It is very important that when these policies are formulated, they aim at substantive equality and they do not create a layer of discrimination, which is sometimes possible. I can give you an example. Some policies that are very much targeting women so that they can stay home. If from one side, there are certainly advantages, from the other side, these are policies that if they're not well designed, they can actually regress the position of women in society. So this is what is very important to look at when we propose care policies. We have seen, for instance, countries that have tried to have very long maternity leave periods for women and only and no other policy for men and for men or for other relatives in the family, that women have been penalized when they went back to the labor market. So it's very important to formulate policies that promote gender equality in a very progressive way and that tend to try to equalize. The second part that is very important is that these policies need to be universal. They need to be adequate and they need to promote equity. So they have to be for everybody. The third part, this third aspect is that the overall and primary responsibility of care policies, and we said before that care policies are public policies, lies on the state. It is the state that is the primary responsible for formulating, funding, and implementing good care policies. And this dimension and the role of the state is very much grounded on the fact that care is a social good. The state, therefore, has a leading role in providing services, in designing good policies, and in effectively regulating the market, because we know that care can also be provided by the private sector. The private sector is also a care provider in many countries. And therefore, it's very important that it is the state to make sure that everybody are entitled to care policies and everybody have access to good and affordable care policies and therefore care services and infrastructures. And the fourth part, which is also extremely important, is the fact that these care policies need to be designed, funded, and formulated on a basis of the real needs of people, the voices of the people. And this is why it is extremely important to have social dialogue around any policy, any care policy that is put forward. Unfortunately, due to a lack of gender equality in many organizations and in many political processes, it very often happens that a lot of care policies that are designed and that target primarily women tend to be designed by men. So not always reflecting the real needs, or perhaps encapsulating a lot of those, gender stereotypes that have been historically portraying the man as the breadwinner and the woman as the second earner. So all of this, just to give you an idea of how important care policies are, because they're important in everybody's life, and how important it is to design policies that go beyond simply the idea of providing a service, but they have a much longer view in terms of outcomes. So going back a little bit to what Umberto was saying before, having transformative care policies makes sense, not just for society, but also for the economy. And good care policies can actually have good, promote good health, economic, and gender equality outcomes. And so we see that in countries where there is a generous welfare state, we also have more women and also men that are in the care sector. This means that with better policies, and Umberto, in case you can jump in to correct me, with better care policies, we also have better working conditions of the care sector. Now, going back to some of the basic policies that we mentioned before, the policies that very much care policies that look at time, that provide time to care. So the one that is recognized everywhere in the world is the maternity leave. Unfortunately, maternity remains a right that not many women have around the world, because as a matter of fact, only 77 out of 184 countries around the world provide the minimum standards on paid maternity leave. And maternity leave is set out in the ILO Convention number 183. And so here the problem is that we have a very large number of women, and within this women, a lot of domestic workers that do not benefit from the care policy of maternity. and do not have any type of coverage in when they fall pregnant and they have their first or second or third child. So this is an area of work where I think within IDWF, you know, I think it's very important to continue to work, because as we said before, there are many countries that actually do not provide maternity coverage to people in the informal economy, or that exclude domestic workers from their labor legislation and from the social security systems. Another policy that is interesting and that as well, you know, helps reallocating time is paternity leave as well, something that it's an area where the world is changing its mind in terms of being much more prone to the idea of paternity, and we have seen a lot of laws that have come up during the past years, and also with COVID-19 extending paternity or providing paternity, because paternity is also another way of providing time to care and to redistribute the unpaid care work of the mother. But this is an area of work that certainly will require decades to have real effects and benefits in terms of redistributing unpaid care work. And then the other area that is very important is care services, early childhood care and education for children aged 0 to 2. This is an area that is very much important for every woman, including domestic workers that have children. And we see very much how this is an area where countries still are not investing enough. It's an area where a lot of countries do not have provisions for children 0 to 2 years. And this is an area that could be as well of importance for domestic workers to advocate for. While we see that there are more services for pre-primary education. So to conclude, what the ILO is proposing, and I'm pretty sure that you have already seen this, is a 5R framework to decent care work. And by 5R, we mean recognize, reduce, and redistribute unpaid care work, reward, because care work needs to be rewarded and care workers are entitled to decent work. And the 5th R is represent. We need social dialogue and collective bargaining for care workers, including domestic workers, to be very much recognized and very much practiced. And so care policies need to be integrated within the macroeconomic policies, because that's where funds that go to care policies are distributed, are decided. They need to be integrated with social protection policies, with labor policies, and also with migration policies. And just to conclude, in terms of what the ILO is doing on care work, there are several initiatives that look at together, actually it's a project together with UN Women that is active in different countries, in Latin America, in Africa, and in Asia, I believe. And that is doing some work on care at macroeconomic level. So really trying to influence the design of macroeconomic policies, taking into consideration care policies. From our side, we are currently developing some new knowledge that looks at legal developments during the past decade on care leave policies in particular, and at the same time trying to look more at the impact of care policies on the economies of countries, so to strengthen the business case of care policies, while also doing some costing of care policies. And in the field, we also have colleagues that are currently working on childcare making sure that childcare facilities are affordable and are available for parents. And we have different studies ongoing, including in the informal sector. So I think that's it from my side. And if you have any questions, I think we will all be happy to respond.
I actually kind of had one that I thought might be useful. It was on Emanuela's slides, but Umberto, I think you're perfectly in a position to answer. In terms of, so the care policies. So care policies, we talked about the paid, the money, so redistributing money. We talked about the services, and we talked about time.
Yeah.
And then underneath you had macroeconomic policies. And so I wonder, and then Emanuela mentioned this project that the ILO has on care, looking more at macroeconomic policies. And I think it might be useful to explain just a little bit more what that means and, you know, what is the objective? Because I think, you know, one of the important messages that I hope we can get across today is the ways in which care policies affect domestic workers. And obviously there's a lot of different ways in which that's happening. And just to name a few, domestic workers can be the subjects of care policies in the sense of, you know, when we advocate for domestic workers to be included in maternity protection, you know, domestic workers are women with care responsibilities of their own, and care policies need to apply to them and benefit them. So, you know, ensuring that domestic workers have access to affordable childcare and maternity leave, you know, domestic workers then end up being sort of the subjects, the recipients of, or the beneficiaries, if you will, of a care policy as, you know, as unpaid care workers. Then domestic workers are also related to care policies in the sense of you know, as paid care workers. So paid care workers, in this case, you know, and so, okay, so then here's the question, right? If you have a care policy, if you look at countries like Norway or, you know, the Scandinavian countries, as Emanuela and Umberto pointed out, they have care policies that have made it so that work that's performed in households, what we know as domestic work, is basically covered by the public sector. So they have allocated resources to and invested in, you know, creating employment, formal employment, financed by taxes, I guess, to provide services in the private household. And therefore, when we look, to go back to the statistical definition, when we look at the number of domestic workers according to the statistics in Scandinavia, there's like 1,000. There's very, very little. But that doesn't mean there's only 1,000 domestic workers. What it means is that domestic work is being carried out by people who are employed in the public care sector. So, you know, this is an important distinction to make. It's still domestic work for the ILO, but the important thing is that these are domestic workers who are formal and who are covered by the law and who have rights and benefits, etc. So that's a care policy that ensures decent work for domestic workers the way we understand them. But then there's the other side of the coin, as Umberto was saying, in contexts where there are no care policies or very few, or where care policies ignore domestic work, then what happens is that, you know, households that have care needs, they end up going to the informal market to hire domestic workers at a very low price for very poor working conditions. And then statistically, we see that there's a big number of domestic workers all of a sudden. So the existence of care policies is very closely linked to domestic workers, the number of domestic workers being employed directly by the household. Now, so this is a very long question. The question ends up being, how can macroeconomic policies be used to ensure that domestic work is formal and with decent working conditions? And that's where I think the care economy discussion is so important for IDWF.
Okay, it's for me? Yes, okay. So, okay, so basically, yes, how can we ensure that macro policies is used to have to create decent working conditions for domestic workers? I mean, I really liked your point, Claire, when you talked about the statistical definition. Yeah, it's really true that the estimates that we presented are for those domestic workers employed directly by the household. So it means that these are those who are more at risk of being informal, of being underpaid, of being not protected. Because the other domestic workers, the one that you mentioned in Norway, are basically not in this industrial classification that we used in the care report, but they are probably employed in social work. So it's a different categorization, and it's with maternity protection, with all the protection that you have in the public sector. How can you ensure that macro policies create decent working conditions for domestic workers? Well, the first point is to have the necessary resources allocated to care. And this is, you mentioned the project with UN Women, and this is what they are trying to do. So to have this, you need to have the political will. Because if without political will, there will be not a creation of fiscal space for the care economy. So what did they do to motivate the countries in this project to invest in the care economy? We call invest. Because it's actually an investment in human capital. So they did a study. They are doing studies in country-based studies to show the potential job creation and GDP creation of such investments. And this is what we have done also in chapter 5, less in detail. So we have done an aggregated studies. I mean, we have country level estimate, but we didn't go to each country to the field to collect the data, but they are doing that. They used input-output tables to show the benefits of inserting these jobs. Because if we think about domestic workers in the informal sector, underpaid, okay, they have just this is simply they are doing basically what we call a business case. So if you think about these domestic workers in informal sector, in low pay, they have a GDP potential creation. While if to this employment you give a decent salary, which is actually not below the minimum wage if there is one, you pay social security contribution, you have other protection, this means that also the GDP will benefit, because these additional salaries will then be spent in the economy and will generate additional GDP. The other point is that there is an historical reason why in certain countries, especially I would say in developing countries, there is a tendency of the state not to invest. One reason is the IMF approach to public finance, because an expenditure, and here you see I'm changing the word, I'm talking about an expenditure, because for a moment I'm wearing the IMF hat, even if I don't really like it personally. So the expenditure on salaries of those who are social workers, so domestic, that carries out the task of domestic workers, is often not seen very well by the IMF in certain developing countries, because it's seen as something that can be reduced. And therefore, there is actually a need to show that spending on social work and on the care economy is actually something that is vital for a country. Is not an expenditure as classified in the IMF government statistics, but is an investment, because this will add human capital, will not put the household at making trade-offs between women being at home or being employed and having several difficulties for caring for their children, for their older relatives. Macro policies, I think they really, and the role also of the ILO and of us is to show that if we expand the fiscal space for the care economy, the benefit will be not only for domestic workers that will then receive a decent wage and have social protection guaranteed, but will also be for the entire economy. For also those women who have to make trade-offs between being employed and being at home, for the economy as a whole, because there will be GDP creation, there will be new jobs. And this is actually what a bit they are trying to do in this project with the UN Women, to show really this and to challenge the assumption that the role of the state should not be dedicated to these issues, while it's very important. I'm not sure, Claire, did I answer your question?
Yes, very much so, and even more so than I expected. And I've always wondered this, so it was really helpful for me to learn about how this works. And I think the point that you made about developing countries is so important, because I often assume that the reason why they don't invest in care policies is because they don't have the money to do it. And it's helpful, I mean, maybe they don't, but it's helpful to remember that there's also these institutions like the IMF that are putting pressure on them not to invest in public services like this. So I know that in the last discussion, we heard from some countries, particularly in Africa, where it just felt like the care economy or care work doesn't really mean anything there. And I think this is probably one reason why, is because there's not really an investment in care in a lot of these countries. That's probably the reason.